Hi, my name is Manisha Gandhi. I'm one of the Maternal Fetal Medicine Specialists at the new Texas Children's Pavilion for Women with a special interest in multiple pregnancies. So you're mom and you just found out that you're having twins. Although it's a period of extreme excitement, it probably is also associated with some anxiety. And there are 5 questions every new mom who's carrying twins or a higher order multiple should ask their OB/GYN. The first one is, should you be followed with a maternal fetal medicine specialist? Now this is a discussion you should have with your obstetrician about the high-risk nature of your pregnancy. Higher risk multiples such as monochorionic or identical twins or triplets need careful combination of care between a maternal fetal medicine specialist and an obstetrician. A lot of what we call fraternal twins can be easily managed with a little bit of direction from the maternal fetal medicine, but can be managed by most obstetricians without any complications. One of the second questions you should ask is, what type of twins or triplets do I have? This is a really key component and probably the question that I consider to be the most important when patients are getting care for their twins or triplets. So a monochorionic twin pregnancy, which is 1 placenta with 2 amniotic sacs, has a much different type of monitoring than a dichorionic pregnancy, which is 2 placentas and 2 sacs. And this is critical for the care and well-being of your pregnancy and will direct any future interventions and potential care process for your pregnancy. The third question I would ask my obstetrician would be, if I have monochorionic twins or identical twins that share a placenta, what is happening with the amniotic fluid in between the sacs? This is critical because 10 to 15% of monochorionic pregnancies develop twin-to-twin transfusion syndrome, which is a complication associated with unequal sharing of vessels through the placenta. Therefore, one of the ways we monitor this is with frequent serial ultrasounds that look at the amniotic fluid sac between each baby. The fourth question I would want to know is, do I need to do anything different with regards to eating, drinking, weight gain, things like that during my pregnancy? This is probably another key component of how twin gestations or triplet gestations differ from other singleton gestations. You've probably heard in the past, when you're pregnant, you need to eat for 2. Does that mean when you have twins, you eat for 3, and if you have triplets, you eat for 4? This obviously can be quite confusing, and so it's really important to meet with a dietitian and come up with a game plan. This plan is determined by your body mass index and a variety of other factors that can assist with how much weight you should be gaining and when the optimal times for weight gain are in the first, second, or third trimester. In addition, we have evidence that shows that optimal weight gain is associated with better outcomes. So fewer preterm deliveries and larger birth weights at the time of delivery. And lastly, you want to know, when should I deliver? Although about 50% of twins will deliver by 36 weeks, when is the optimal time for delivery? For dichorionic twins, or twins that have 2 placentas, this is usually recommended by 38 weeks gestation. The more complicated twins are monochorionic twins, identical ones that share the placenta. This may be as early as 34 to 37 weeks, and earlier if other complications arise. So this will be determined in conjunction with care with your obstetrician. As you embark on this pregnancy, I wish you and your family well on this exciting new journey.